Hello and welcome back to the Dubai Science Park Show. I'm Dr. Sheen, your host, and this is day 3 of the World Health Exhibition. I'm super excited today because we're talking about innovation in healthcare and all the really cool projects that are undergoing in Dubai with Mr. Yacine Hadjiyat. Hi Yacine, how are you?
Good morning. Very well, thank you, and thanks for having me.
Of course. So tell us, how is it today? How's day 3 so far?
Busy, as the whole week has been, but it's exciting. I mean, the energy here, the types of interactions are absolutely outstanding. So, and for someone like me representing Dubai Health and working on innovation, this is certainly the place to be.
Amazing. And tell us a little bit about what you do as the head of innovation for Dubai Health.
Certainly. So at Dubai Health, we are an academic integrated healthcare system. So we are a university, the hospitals, primary care centers, a foundation, all that coming as one organization, one governance. And as part of our missions, innovation was also established and identified as one of the strategic pillars to achieve our kind of North Star and goal, which is advancing healthcare for humanity. And the best way to do it is through innovation. So that's humbly my mission and the team and across Dubai Health.
I'll ask a very basic question, but when we say innovation in healthcare, how do you define it?
That's the best question. And it's probably the toughest. Always in innovation, the question is how do we define it? And it's true that sometimes it's kind of a blurry definition. What is the innovation versus normal day-to-day work and so on and so forth? Maybe I'll start with also trying to keep it very simple and very basic, but to the point. What innovation is not about is, first, innovation is not invention. Invention is not enough. Innovation is about adding value, solving problems, and ultimately ensuring adoption of any solution system we come with. So the core definition, at the very core of the definition is innovation, is making things better. When you apply it to healthcare, is making healthcare and the patient lives better. If we don't achieve that, we are not quite in the definition of innovation, I would say.
And when we're talking about innovation in healthcare here, what are we trying to fix or improve really in the system?
Healthcare outcome, I mean, ultimately is the patient care. Can we cure diseases? Can we make the patient lives better? That's the absolute ultimate North Star in healthcare. That's what healthcare is about. That's what being a doctor is about, and so on and so forth. But now if I bring it back to our own context as a healthcare system, innovation, I can bring it down into different missions and blocks. First, we are a university. So our role is to equip and form the doctors of tomorrow, the health professionals of tomorrow. And our mission is to make sure that they are future ready. They can tap into all the tools they can tap into to better serve their patients. So an innovation is one of those frameworks that we equip them with. It's not only about technology, it's not only about products, but it's really about a mindset. And it starts about how we solve problems, how we remain human-centric. And everything else will come to play as a toolbox. So that's within the university, and that's how we apply it with our learners. Then we have a second mission, which is the discovery, the research. To advance science, we need to advance research. And innovation is also about how we translate fundamental and basic research into solutions. So that translational element has also a framework, and that's what we could define as innovation. From knowledge to insight to a solution that we can apply. And at the end, everything goes back to our clinics and hospitals, because that's where we serve our patients. How do we bring the knowledge from the learners, the solution we develop through our research and development, ultimately to our patients and through our doctors? So that's how the entire ecosystem comes together and enabled by innovation.
No, that's really cool. You really get to see everything from the problem to it actually getting into there. But what is your favorite part of your job?
A normal week, it starts with the university and the learning and interacting with the first-year medical students. That's quite interesting, as interacting with very young students, 17, 18 years old, joining a medical university, expecting to go hardcore in cardiovascular and anatomy. And I stand in front of them, telling them we're going to talk about innovation and technology. And they're like, why do we have an IT class in medicine? I want to become a doctor. And then see them how they evolve over their semester and how you unlock their curiosity and they get genuinely excited about the impact they can make. And then from that and from the university and the learning, we get to work with our researchers and through the labs we have in the Innovation Center. So we have a sensor lab, an AI lab, a design lab, an XR lab, and we have more than 20 projects that we take from 0 to 1. Like really, we develop solutions, we test prototypes, and we also do it through partnerships. So a lot of my time is also building collaborations with academic institutions in the region or globally, or with the private sector. And finally, working with our hospitals and clinics to take some of those solutions and see how they work how they operate in a real life setting. Either it's a system implementation or a patient-facing solution. That's again a kind of a continuum we live in, and it's quite exciting.
Yeah, it gives you such a wide variety of different types of hats to wear as well. But I know that we also have a lot of projects that you are overseeing. Will you tell us about some of the more fascinating ones?
Sure. So the project, the 20 plus project I mentioned, they first have a distribution across some of the core disciplines and labs we have in the Center for Innovation and Technology. So we have a design for health lab, an XR and brain-computer interface, sensors and wearables, AI and data, and they kind of spread across the different labs. So the design for health lab will focus into patient centricity, system thinking. The AI and data will focus on data and building algorithm. Sensor and wearables is one of the busiest lab we have in the center, trying to work and implement wearables and personalized medicine through wearables that we could apply either for general population or our patient. But maybe to pick one and highlight one or two of those projects. One of the flagship project we're developing across the AI lab and the sensor lab is a project called Pain Detect, and it's funded by Dubai Future Foundation with the RDI grant. And we're trying to tackle one of the most pressing challenges in medicine, which is pain. Pain is a universal symptom. We all experience pain, or we will experience pain in our life. And the way we assess pain today, and it has been the same probably since humanity exists, is a subjective measurement. You have to ask a patient from 0 to 10, how do you feel? And if the patient says 9 or 10, you can prescribe and give heavy medications like morphine. There are no other indications or diseases where you would ask the patient to guess his own.
How bad is it?
Exactly. I would never ask a patient, can you guess your glucose level today? How is your blood pressure? Give me a number between 10 to 25. We never do that. But in pain, that's the only way we can interact with the patients. And some of the patients cannot even answer back. Pediatrics, ICU, dementia. They cannot respond to the question, but that does not deny their pain. So by using machine learning and biomarkers and physioparameters deviation models to try to find a way to quantify and to objectivize pain measurement. So can a smartwatch capturing the body reaction to pain tell us this is pain and no pain, or also give us the 0 to 10 in an objective way? So that's an exciting project. It's a tough one. It's a 3-year roadmap project, again, funded by our institution, Dubai Health and Dubai Future Foundation. But this could be an absolute shift in the way we manage pain and treat our patients, not only in Dubai, but globally. So this is one of the projects as a long-term R&D development solution that I can highlight. That is quite exciting.
That is so cool. So, I actually studied back pain for 5 years.
Oh, nice.
A very niche area of back pain. But I have to say that comes out so often. Even patients are like, how am I meant to know how much pain I'm in?
Exactly.
So this will really revolutionize how doctors around the world are approaching pain. I can't wait to see this.
3 years project, a roadmap.
3 years is a short time in healthcare.
Yeah, absolutely.
Research.
That stresses me actually. But and it's a tough shot. And again, we may or may not achieve that goal. But even if we just land close enough to it, that would be an amazing step forward for
absolutely. And if anything, you will create the next questions that we need to answer, which is always the way forward with research. And I know you also announced recently a new one about wearable device for diabetic patients.
Yeah, absolutely. And it was announced yesterday at WHX, and it's a collaboration and a partnership with Huawei Technology. So they are developing a suite of solutions of smartwatches with healthcare indications. And they developed one for diabetes and trying to measure through smartwatch blood glucose. So it's a partnership between Dubai Health and Huawei through the Center for Innovation and Technology. We're going to run a study and test this technology versus the standard of care for blood glucose measurement across our healthcare facilities with 150 patients. So 50 are healthy volunteers, 50 are pre-diabetes, and 50 are known and documented with diabetes. And we will assess if technology could potentially come and complement the standard of care and the blood draws and so on and so forth, and offer a more continuous, non-invasive monitoring, especially for patients who maybe are not aware that they have a diabetes or they are in pre-diabetes. Those are very high-risk patients. And maybe a wearable that people can buy and use in their daily life can help them identify and control better their blood glucose. So this is another example of how we use wearables and sensors in healthcare.
I love that. And from all the things you're talking about, there's the education side, the research side, there's also the patient side, the doctor side. So collaboration becomes quite key whenever we're talking about these things. And why do you think exhibitions like the World Health Exhibition really helps in terms of fostering a platform for people to collaborate?
Yeah, I mean, I think it goes back also to your first question, what do we define as innovation? There is no definition of innovation in silo, or you're trying to be alone and trying to solve the world problems on your own. It comes with collaboration. One of the core principles we have in Dubai Health Innovations and our center is multidisciplinary work. We are healthcare professionals, doctors, and scientists, but to solve healthcare problems, it takes much more than just healthcare professionals. We know what we know, but there's so much we don't know. So we work with designers and with engineers, for example. So we have partnerships with a lot of academic institutions like Rochester Institute of Technology, Dubai Design Institute, American University of Sharjah, all the way to NUS in Singapore, UMass in Boston. So we bring different perspectives, knowledge, and backgrounds to solve those problems. But I also highlighted the project with Huawei. That's how we bridge as well the private and the industry sector.
Right.
Because we can be good at academics and trying to solve problems and be good scientists. But if we don't work with industry and other types of discipline to take those solutions and knowledge into scalable solutions, we will also be limited. And I think gatherings like WHX are those meeting points, nexus point where we come all together. It can be sometimes overwhelming, let's be honest, but that's what it takes to meet with the like-minded people, companies, researchers, and other academic institutions, and then ultimately come together and solve the same problem.
And, I'm just going to mention the word that everyone talks about when it comes to innovation, which is AI. What do you see as the role of AI as someone who's, leading innovation with Dubai Health in healthcare?
It's obviously an important modality, a critical technology. We all have that hope that AI will help us maybe enter in a new era for humanity, and we certainly embrace that hope and that work. We have an AI and data lab in our organization, but I don't want to inflate AI just for the sake of saying, on putting a brand and a claim saying we do AI. Yes, we do AI. We have an AI and data lab, but it's a modality. It's an enabler of many, many other things. The Pain Detect project is enabled, if we will, with some AI and computer scientists we have in the team. But I see it more and more as the electricity that powers a lot of things, rather than being the ultimate outcome of what we do. It's an enabler, and we totally embrace it. But I don't want to inflate it either.
Yeah, I love that. Okay, and looking to the future now, where do you see Dubai Health kind of leading the future of healthcare? Where do you see the space that will blow up in the next few years for you guys?
We're going to hopefully take a humble part and share of the global effort. But what I see coming strongly at Dubai Health is really our depth of research and discovery we have across the organization. The beauty of Dubai Health is that we are an integrated academic healthcare system. We bridge and bring together the university, the research and discovery, the patient hospitals and clinics, everything enabled by the giving. And of course, I'm highlighting the role of innovation in the Center for Innovation and Technology, but we have a Center for Genomics, for microbiology, for cancer, a biobank, protein engineering. So we are at all the fronts of the battle to make healthcare better and advance healthcare for humanity, humbly at our scope and scale, but we are certainly serious in our commitment.
Amazing. Well, I'm super excited to see where you go with this, and very excited about the Pain Detect. Thank you so much for your time, Yacine.
Thank you so much. Thanks for having me again.
Thanks.